Let us talk about another bacterial disease, that is leprosy. The causative agent of leprosy, it is Mycobacterium leprae. So we need to know what is the causative agent. So the causative agent, it is Mycobacterium leprae. This is Mycobacterium leprae. How it is spread? So what is epidemiology? It is spread through direct contact. As when you come or if you touch the patient, then it may spread to you. So through direct contact, the infection reaches to a healthy person. Now what is the problem? The problem is that this Mycobacterium leprae, actually it releases a histolytic substance. So this is important, that this pathogen, this is Mycobacterium leprae, it releases a histolytic substance. A histolytic substance. And the name of that histolytic substance, it is called as lepromin. This is actually lepromin. So this histolytic substance, it is lepromin. What this lepromin causes? This lepromin causes, as the name suggests, it causes it is a histolytic substance. Histo stands for tissue, lytic means slices. So basically this toxic chemical, it is responsible for breakdown of tissue. So this is responsible for tissue breakdown. And actually that is the problem. If a patient is suffering from Mycobacterium leprae, so usually even let's say the treatment is not that much available. Of course it is less available because whoever directly come in contact, that may become infected, although precautive measures are always there, right? So this lepromin, what it causes? This lepromin causes tissue breakdown. So basically the extremities what are present, such as let's say fingers, most commonly affected organ are finger. So these fingers start to dry and then they start to shed off, right? Similarly of the leg finger, these hand finger, these ear pinna, usually this nose, the cartilage tip of the nose. So may possible that with the time they dry off and they shed off. So we can think about that a situation that a patient who is without fingers, and then these finger goes down and what you have only palm, right? So this is the thing. Actually this is the problem with this bacteria, that is Mycobacterium leprae. It releases a histolytic substance, that is lepromin, and it causes breakdown of the tissue. That is something what you need to understand, right? What else are the symptoms? Okay, what are the symptoms directly? So first of all, as I told you, breakdown of tissues, that means it causes deformities, right? It is important. So it causes deformities. Okay, it causes symptoms I'm writing. So the first and the most important symptom, that is deformities. It causes deformities. Apart from this, loss of pigment is also there. Loss of pigment from the skin is also there. So it is also called as dyspigmentation. So this is important. Okay, or rather it causes discoloration of the skin or discoloration of the pigment. Discoloration of pigment. So that is the symptoms. A mild fever may be present, not very severe fever, a mild fever may present. So a very low grade fever, may present. Now, one of the symptoms that is not directly, that is indirectly, if the patient starts to lose of, let's say the patient is observing that he or she is losing their finger, a mental stress is always there. So a mental stress is always there due to the same. So mental stress. Now it is indirect symptoms. And due to that, weight loss may be reported. Weight loss. Okay, so these are some of the symptoms that is associated with this particular bacteria or with the disease, that is leprosy. What is the treatment? If it is a bacterial disease, treatment would be anyways antibiotics. So treatment is antibiotic. Okay. What else we need to know? So that is about the leprosy. That's all about the leprosy. So we have done how many diseases? We have done leprosy. We have done in the last class. I guess we have done diphtheria. We have done pertussis. We have done tuberculosis. We have also done pneumonia. We have also done typhoid. Let us discuss one more disease, that is cholera. Although now, because we are more aware, people are educated about and they are aware about their health, the cases of cholera are not much significant in number. Okay. Cholera, it is again the causative agent is a bacteria, that is Vibrio cholerae. So it is a coma shaped bacteria. So the causative agent, it is Vibrio cholerae. It is a coma shaped bacteria. So the bacteria looks like that. So it is a coma shaped bacteria. Now what are the symptoms basically, and what is the problem? And usually before the symptoms, how it is spread. So how it reaches to a healthy person? So it is spread through contaminated food and water. So it is spread through contaminated food and water. The problem was more severe in earlier days, because earlier in olden times, in villages, in rural areas, the health is not taken to be very serious. The hygienic problem is there, so there are more chances that usually the child or sometimes infant get the disease, and it is very difficult to manage infant in earlier time, because in rural areas, let's say, hospitals are not available. So in earlier time, even medicines was there in such in small places. There were not hospitals, big hospitals, so Anganwadi Kendra kind of things were there, and in which only medicines were distributed. Anyway, what are the symptoms? So the symptoms are not very of course the symptom can become severe. So why it can become severe, let me tell you. Although they are not very very peculiar symptoms, so the symptoms, first of all, fever. Second is diarrhea, watery loose motion, right? So it is a watery loose motion, basically this is important. So diarrhea, it is diarrhea. Now if the diarrhea is not controlled, if it is a very severe diarrhea, it may possible that it may lead to dehydration. Maybe you may be surprised to know that earlier many of the infants die because of cholera. Yeah, because lack of knowledge was there, right? Again, what is the treatment? Although vaccine is available for the cholera, but awareness is there among people. That is why usually the vaccine is not given to the infants. Anyway, so what is the treatment? The treatment is anyways antibiotics. And to restore the health, we can give oral rehydration therapy. So along with that, to rehydrate the body, we also give ORS. ORS stands for oral rehydration solution. So it is not just water, it has iron along with water. And even if ORS is not available, although nowadays ORS is available in every government hospital, in every private hospital, in grocery shops as well, I guess so. And even in every private and government hospital that is available. In every medical store it is available, right? One can go and ask for the ORS. It is just, I guess, 5 rupee or 10 rupee packet, I think so, basically. So in diarrhea, one should supposed to take this, even adult as well, because we need to understand that in diarrhea we are losing the water along with ions. So intake of water is not only enough, we have to maintain the ionic concentration as well as in the body. So that is why it is important to give ORS. But let's suppose if the problem is there in the midnight and shops are closed and it's difficult to go to the hospital, then we can give a solution, ORS solution. We can prepare it at home as well. So what we have to do, we have to let's say, and make sure that, because the disease is due to the contaminated food and water, usually it is a water, so we have to keep the water boil, allow that water cool, and then add some amount of a salt and sugar in that water, mix it properly, and then give it to the whoever is infected. If it is a child, then give through the spoons, just 1 spoon, 2 spoon in every 10 minutes or 15 minutes, let's say, and whatever the amount a child can take, of course, or child can drink. But if it is a, let's say, adult, and it's a night time, difficult to go to the hospital, diarrhea, severe diarrhea is there, one should then take this solution, at least ORS, and we can prepare it at home as well. So this is all about the bacterial diseases. We have completed 7 bacterial diseases, and let us now from the next video started with the viral diseases. I'm hoping that you guys are liking and liking these video, and you are learning a lot. And if you are, then kindly do subscribe the channel. Thank you very much.